Well, the Research Institute is something we're very proud of. Tom Farron and I started that about 24 years ago, and it started out as just a method for keeping track of our total joint patients and see what we were doing well and what we were not doing well. And it's grown to where we now have 9 full-time researchers, and we currently have about 30 FDA clinical trials underway and over 80 scientific outcome studies in progress. So we average about 30 publications a year in peer-reviewed journals, and it's managed by Christy Cadd, who's done a wonderful job. And then I'm kind of I don't do much. I'm in name the medical director of the Research Institute. So the mission for the Research Institute is primarily orthopedic research, but also education. And the Oscar Miller Day event kind of combines the two. We in the name of Oscar Miller and Basil Boyd, who is very much an advocate for resident research, we have kind of a competition for regional residency programs, and residents present the research projects and they receive an award. So it's to try and emphasize and encourage residents to go into research and become clinical researchers. And then also it allows us to do some teaching to regional orthopedists, therapists, PAs who work in the field of total joints. So it covers both the research and the education piece as part of our mission statement. So there's been a lot of excitement, not necessarily good excitement, about metal the last few years. And as I mentioned, 10 years ago, we weren't sure which direction to go, whether to go with the new polyethylenes that potentially had some issues, ceramics which had some issues, or metal which we had been using for 30 years. So at that time, metal seemed like a very good option. There's a lot of different metal designs out there, and they behave differently. And so some have had some very bad results. Others have actually outperformed metal on poly. So there's a spectrum as to how they're performing. But because some of the bad results are pretty bad, most people are shying away from metal. I think the use in England was as high as 40% of all implants were metal 2 years ago, and that's dropped down to 5%. So the pendulum is definitely swinging away from metal right now. And I think our alternatives with the cross-linked polyethylene and the newer ceramics are pretty attractive. Some of the ceramics are available, not in some of the larger head sizes, and so I think those will be rolling out with FDA approval in the next year or two. So there's not a full gamut of ceramic options available right now. Well, one project we just completed, which is pretty timely, is looking at the correlation between ion levels, which is supposed to be an indirect measure of how the metal bearing is performing, and the soft tissue damage at the time of revision surgery. So we've accumulated about 120 revisions and looked at soft tissue damage versus ion levels, and the thought was that anything above 7 parts per billion was at risk for problems, and we found there's really not much correlation between the ion levels in the blood and the amount of damage in the joint. So that's something we're going to present actually at the hip and knee meeting in Dallas in a couple of weeks.